Welcome to the Hype Life Podcast Experience, where we teach you what you won't learn in school. From careers to financial literacy, we give you the information you need to bridge your passion with your purpose. Welcome back, and thanks for joining another episode of HypeHuddles. Today's guest is Dr. Nick Hernandez, a New York native of Peruvian and Puerto Rican descent who proves that through hard work and perseverance, your dreams are always attainable. Nick has an incredible story of his journey from being gravely ill at a young age to becoming a family medicine doctor in Long Island. You're not going to want to miss this one. Let's dive right in. Yeah, I know your story personally, Nick, and we've talked about this before. But speaking of those trials and tribulations, can you give us a little bit of the background and tell us a little bit of where it all began, and kind of maybe start with your childhood and what kind of interests you had as a kid?
Sure. So my parents met in Brooklyn, and they ended up moving to Rochester, New York. So everyone talks about upstate being like Yonkers, New Paltz, Poughkeepsie. Not. That's like an insult to an upstater. Anything north of Albany is considered upstate. So, I grew up in a very white town. My parents did a great job maintaining the Latino culture. We used to watch Don Francisco, listen to the one time a week Spanish station that we had, that would run on Saturdays, and, even attend some of the Puerto Rican festivals that would be in Rochester. And as years came, the culture would kind of grow a little bit more, but it was a very unique setting to grow up in. My being of color, my father's from a town where there are deep African roots in Peru called Chincha. That's where I'm not sure if you've ever seen it, but it's an instrument called the cajon. It's a actual box, and they play it as a percussion instrument. That's where it was born. So, we had a very rich culture within our home setting. But when we left the home, and I was in kindergarten, I was in first grade, I remember being the oddball, being the different one. So it took time for me to kind of really realize who I was. From a cultural background, but also from where I was going in life. And I remember pre-first, which was kind of the grade in between kindergarten and first grade, because you didn't go to preschool, but yet you weren't ready for first grade. Most of the minorities were there. There was a Turkish kid in my class, and we do, share and tell. And I didn't know what my father did. He worked for Xerox. He was a logistics manager, but I didn't know that at my early age. So I just said he was a good man. And, growing up, I just kind of, when at one point, one of my friends called me a black walking birthmark. So it was like, I kind of took that and just laughed at it, but I didn't really realize what was going on until I was in the 7th grade, where I met another Puerto Rican, and there was this girl named Vanessa. And she was like, I was like, wow, there are other people like me. And my family, my grandparents lived in Glen Cove in Long Island, and our church is in the Bronx, right across the street from where Judge Sotomayor grew up. So that's the place I love going to, because that's where I felt like I was home. I was fitting in, like people were different, and that was okay. And I really embraced that. And then culturally, I started playing the cuatro. And, as I grew in my youth, I started to adapt this sense of embracing my difference. So when I was 14, I became very ill. I was a, honor student. I was in 9th grade science and math in 8th grade, and I was doing very well. And that kind of put a sudden stop into my ability to thrive academically. I was basically trying to pass each year, but just by studying regions and moving on to the next. I got into AP courses, but I was very sick with an intestinal illness known as ulcerative colitis. And I battled that illness for about 3 years. At one point, I dropped from 120 pounds down to 76 pounds. I was in and out of the hospital, and it was not a conducive or normal setting for someone who's going through, their teenage years. And really, that crucial time during high school, you're really trying to kind of see what kind of personality am I? What are my likes in life? I was struggling with this illness. So finally, when I overcame the illness, I had passed through a lot of different situations as a patient. I remember at one point there was a medical student who was trying to get an IV in me, and they asked me, "Do you want the IV in your groin, or you want it in your feet?" And I was like, "I don't touch my groin, go to the feet. And every morning, 6 a.m., this husky person would come in and try to get, blood out of me, through my feet. And, and at one point, my mom had to kick the med student out. And I always remember that because it was like, it got to the point where they were just trying to get something and they weren't really listening to the patient. And I always kind of knew I wanted to go somewhere into medicine to help people, as the kind of the stigma always goes, but when people would ask me what kind of doctor you wanted to be, I said a good one, because I really didn't know. Initially, when I started medical school, I thought I wanted to be a surgeon. That very quickly changed as I was going through the clinical setting. I started realizing this is the same surgery over and over again, and I'm getting bored. And I'll kind of touch on that a little bit further. But after I thankfully got cured from my illness, I started a New Visions program. It was a basically countywide program where students who are interested into going into medicine would dedicate their senior year to study basic courses like anatomy, physiology, some chemistry, and then you get to work in a hospital for half a year. So that was kind of the appealing part. And you would think that's the last place I want to go to after spending 3 years, of being sick. And but it was just something that was calling to me, and I found myself happy in that setting. So eventually I went to college, and it was like a shocker. I, was trying to make up for time that I had missed in high school, plus trying to adapt to how do I study? How do I get through these courses? As a first generation US college, student, my parents, even though my father did complete his last year at university in Rochester, he hadn't gone through the whole experience. So it was very tough. And eventually, I got through it, but there wasn't really much orientation. At one point, I think one semester I was taking 5 science classes. So that's unheard of, to take 16 or 18 credits science-based, to have 3 different sciences with labs, that's like double the sciences. So you're talking about 8 classes. And that really hurt my GPA a lot. And, I think that in itself kind of ruined my chances for going into an American school outside of, Mcat and a lot of test anxiety. So it was a process. And eventually, I had graduated college, and I was applying for medical school the second time through. And at the hospital I was working in Long Island, one of the resident physicians approached me, and he's like, yeah, I heard you want to go into medicine, and, tell me what you've done. And he basically graduated from an international program where you do, as opposed to 4 years, you do 5 years. So you do 4 years in Mexico and then 1 year in New York Medical College, and you would get a special certificate saying that you were apt, and pretty much a equivalent to an American graduate. So he's like, you want to go to medical school, you apply here, they'll take you, and the end of the story. It was a very atypical route. It was a lot of risks, but I'm always grateful to that friend, because had I not known that there was other options, I probably would have, ended up doing something else, or, maybe not gone through the route I wanted to go through. So went to Mexico, did my 4 years of medical school, had more clinical experience than I had, through a lot of the typical med school here, where you do a lot of, studying from day one. You're seeing patients at med school. So it was a different concept. Now the medical schools are, engaging in that newer concept. But back then it used to be more traditional basic sciences. Then you go into clinicals. So once I graduated medical school, I was having difficulty with passing my entrance exams for residency. I took it about 4 times before I could actually pass. But I had a lot of family support, friends. I am always kind of campaigning for yourself, looking for ways on finding good motivation, good energy to really use that to really accomplish whatever that you're hoping to accomplish. So finally, after finally passing the exam, I was able to finish the 5-year program, and then I applied for a residency. I became nervous because there's multiple exams you have to take before you go into residency. It's 3 exams altogether. So 2 of the second exam, I ended up putting off a year just because I got too nervous to take it. Eventually I took it. I I passed it. I had done already a rotation with a program in Massachusetts for residency, and I was able to get into that program, thankfully, because they saw that I had something unique and different, and I brought that into the program, and it really, they were really excited to bring me in because it was a fairly qualified health facility. It was the specialty I picked was family medicine. It's a comprehensive care. You do what they call cradle to grave medicine. So you're delivering. It's just like the old school doctors. You're delivering babies. You're seeing people of all ages. You're dealing. You're taking care of elderly in the nursing homes. You pretty much do a little bit of everything. And I really enjoyed it because there's a lot of variety to it. So I left an impression because I was bilingual speaking too. The community where we would do our clinics was mostly Puerto Rican and Dominican population. So they were in need of a physician that spoke Spanish, and being that I was going to be there for 3 years, that appeased to them as well. So thankfully I had a lot of great opportunities. I was able to deliver 46 babies, including a set of twins. And then I finally came back to New York, working for the same health system I had worked 10 years prior. It was very surreal because the same people that I was working under as a physical therapist, they now were working under me as a physician. I was ordering physical therapy for them, and my original boss, I had re-met with her, and it was very Back to the Future. It was very weird. So it was a very small world, but you get a lot of stories out of it, and it was funny because even throughout the path of my training and my academic career, I would always remember some of the things that my friends would tell me. And one of them told me one time, as long as you don't give up, you always have a chance. So, it was that ability to, if I didn't do well in something, getting back up, trying to do better at it, and keep moving forward and finding the opportunities. At one point, the residency program, when we were applying for clinical sites, they had shut down the service to us who were considered foreign medical graduates. So you had to kind of find your own clinical rotation. At that time, it was very, very tough because everyone's kind of competing for spots. Just to give you an idea of what a residency program looks like, there are 6 spots per year, for example, in family medicine. And of those 6 spots, there is more than 4,000 applications. Of those 4,000 applications, they have to weed through and bring in, let's say, 100 people to interview. And of those 100 people, they only list 20 people. So the odds are very, very meek. And you have to figure out a way to be able to beat those odds. And a lot of the times they're not just looking for perfect grades, they're looking for the whole package. So what you bring to the table, even if it's something like myself, where I play my great grandfather's accordion that he used to play, 50 years ago, I put that on my resume and I let them know, because maybe there's something that that particular person who is interviewing you can connect with you. And that's what it's about, is having those connections and really understanding. And even as a medical provider, you're going to have to make connections with your patients, with the families, and really kind of understand, to be empathetic with them in certain situations. So having that ability and to connect is going to be really important. Obviously, having the knowledge, there's no way around it. No one's going to do it for you. You may have to read a book 5 times, and somebody can just read it 1 time and remember everything. But that'll just make you a better provider, because it took me 5 times to get, but maybe I picked up more things. Maybe there's something, no one's better than nobody, but maybe there's something that I can also bring to the table that wasn't seen from a different perspective. So despite all of that work, thankfully, I was given a lot of opportunities very quickly. I am now, assistant professor for Hofstra School of Medicine. I'm also the clinical assistant professor for NYT College of Osteopathic Medicine. I'm a clinical assistant professor for the nurse graduate program at Hofstra. And I was even able to set up a secondary site of continuity for the residency program at a Spanish-speaking caretaking facility in Huntington for the underserved population. So I've had a lot of great opportunities, despite all of the struggles. I was one of 5 members for the Northwell Health System with the Greater New York Hospital Association to go a month after Hurricane Maria to help out for 2 weeks with medical relief efforts, which was an amazing experience and something I'll take with me for the rest of my life. So, there's always going to be a struggle, but I think the struggle really sets a foundation. And the stronger your foundation is, the easier it is to confront anything that may be coming your way. When COVID hit, I actually got sick with COVID about the first weekend we had it in the hospital. And, it was scary. I had about 10 days where I wasn't improving. Sorry, I always get emotional.
All right.
We lost my grandmother. We lost my grandfather to it. We lost my mother-in-law to it. It's real. This blew everybody out of the water. There wasn't any scientist who could say, yeah, I know what this is about. Even Fauci was stumbled, and he admits it. He's like, listen, I'm still trying to figure this out. But when I got better and I knew I had an opportunity to get back and do what I love doing best, I hit the ground running. I had no more fear. I could relate from a patient standpoint with the patient. Oh, I know this is the cough. Don't breathe deep, do this, do that. I got to see a lot of disparities, I never challenged it, but I respected the virus, but at the same time, I wasn't afraid from the aspect that I couldn't do my job, and there was an emotional toll to it, and there still is, because the other day somebody defined, oh yeah, you guys are heroes. And I was in the news and they were like, oh yeah, what does that mean? I was like, I'm not like a police officer. I'm not like a firefighter. I'm not running in and putting my life on danger, But then when I took a step back, I was like, wait a second, but maybe I am, and in reality, I think that's, it's a certain sacrifice you have to do, and it's a selfless sacrifice. Right now, I'm still in the hospital. I haven't sat down to do one note yet because it's been so crazy. My wife asked me, what were you having for dinner tonight? I was like, I'm not having dinner tonight. I'll see you tonight if you're not sleeping, and I have a 2-year-old at home, but, it's part of the job, and you have to maintain a certain, work-life balance as well. I mean, everything can't just be work. So when I'm home, I'm home. My time is for my daughter. She's only 2 years old, but I think what it is that you really, I think through the struggles, you learn how to appreciate what you have at hand. I may not be a top leader in my hospital. There may have been people who are younger than me that I've trained that have superseded me in a leadership role per se. But it kind of dawned on me by when I brought in one of the former clerks from the ED who's, currently at Mercy doing her physician associate, formerly known as physician assistant program, who's about to go into her first internal medicine. I'm like, let me show you how to actually get prepared for your rotation. And I broke it down for her, and I had no time today. And I literally took 5 or 10 minutes just to kind of show her this, because I know this is something she's going to take. And I said, all you two, in order to thank me, is just pay it forward. Give it to somebody else next. Because I think us we're actually a majority population, but us as a minority, we need to kind of embrace each other. We can't be competing with each other. We need to bring each other up. Through my friend who recommended the medical school to me, Natalia's uncle, who's an emergency room physician, who's basically been in it since high school. He did the Sophie D. Davis program. He's my inspiration, because I know he also had some struggle, and he actually really mentored me through a lot of things. And then there's just, you try to find that positive force. You ultimately can make it, and there'll be lots of paths of opportunities for you to engage in and really strive through. So that's pretty much my story up to today. But I'm always happy to help in any way I can.
Thank you for sharing. You definitely covered, a lot from childhood all the way to present day. I want to take this moment just to open up the floor if any of our guests have any questions for you, Nick.
Yeah.
Also wanted to welcome Tuzri. Thank you for coming in and joining us.
Thank you.
Yeah. What school do you go to? Are you in school?
Yes, I'm a 12th grader in the Academy of Finance and Enterprise.
Awesome. Are you interested in going into medicine at all?
Yes, I am. I'm gonna go to BMCC next year under undeclared health science. Yeah, I'm looking to go into the medical field.
That's awesome. Do you have any questions for Dr. Nick here?
Not yet.
Okay. I'm sorry to put you on the spot, but figured I asked,
No, that's all good.
Yeah. Well, welcome. How about Bryce? Bryce, you have any questions?
Not as right now, but maybe later.
Okay. Are you interested in pursuing medicine at all?
Yes, actually.
Yeah. What grade are you in, by the way?
I'm going into junior year.
Awesome. Well, Dr. Nick, do you have any questions for our guests?
Yeah. So what are your like particular thoughts on pursuing, I mean, whatever you decide to go in the medical field, because the medical field is very large, right? When you say medicine or medical field, you're talking about nurses, you're talking about respiratory therapists, you're talking about ultrasound technicians, you're talking about physicians, you're talking about, mid-level practitioners like nurse practitioners, physician assistants. So is there anything with respect to the application process or the testing process, or even, most of you are in high school, so things are ever changing, right? But is there anything in particular that you have any questions about?
I just wanted to hear, you described the whole like residency process, but
Yeah.
Can you explain it again, please?
Sure, sir. So what happens here in the United States is that you have to go through the pre-medical requisites and usually obtain a bachelor's degree, although sometimes you can get a degree and then do a post-bac. But there are different routes of doing that. And usually your school's pre-med advisor can guide you through, but always take some of that advice with a grain of salt, because a lot of the times they'll deter you depending on your grades, depending on your potential. And if you're really passionate about doing what you really want to do, sometimes those deterrents will kind of be ways to discourage you from a statistical standpoint. So that's something you have to determine. Once you've determined, okay, this is what I really want to do, you go through the 4 years of school. By the time you're hitting your 4th year of college, or even a year after, if you take a break, that is completely fine. You have to do Mcat, or the medical college assessment tests, and try to score. I'm not sure what, because they constantly are changing the scoring pattern, but try to get at least an 80-85% or higher on that particular exam. So when I took it, it was, I think, out of 36, 12 each part. Now I think it's as high as 45, but just take, 0.8 times that, and whatever that number is, if it's a 30 above or it's a 35 above, that's what you would need typically for an interview, plus a very good GPA. If you decide to take a typical route, say your GPA isn't greater than the 3.5 or a 3.7, or competitive enough for the school, or your MCAT isn't where you want it to be, then you can start taking like Caribbean options. So there's St. George's University, there's Ross University, there's Autónoma de Guadalajara, which is kind of a lower bar, but it is a definitely more survival mode type of medical school. So you have 300-400 students all trying to do very well in medical school. They're all taking the same class, competing for good grades. But in reality, medical school, what it's about, it's a 4-year program. After your 2nd year, you take your United States medical licensing exam, and there's 3 different steps to that. The first step is what you take after your first 2 years of basic science. And then depending on how well you score on that first exam will kind of help you get into the different type of specialty you want. So for example, if you want to go into ophthalmology, which is the hardest residency program to get to in the nation, because it literally has, I would say 10 spots in the whole nation, you have to get in the 99th percentile or greater. So say the maximum score you can get on the USMLE is 280. You better be sure that you don't get anything less than a 278. Like that's how competitive this process is, unless you know the program director who's basically saying, okay, you know what, I'm going to pull your application out. But even then, there are so many layers to that. It's not even that easy anymore. Then you have to have your step 2, which is your clinical, that's the basic science one, step 1. Step 2 is your clinical knowledge one. So that's a little bit more towards the end of your 3rd year of medical school. And there you would actually, have to score at relatively high level, but there isn't as much pressure per se. But still you want to do very well if you want to get into a competitive residency program. Even some of the less competitive residency programs that do have very good training, will require a higher number. So sometimes you can just even call their, office and say, hey, I'm thinking about your program. What is your median score of the step 1? And they may be able to tell you, oh, we usually take anyone that's, we interview anyone that's 240 or above or 230 and above, just to get an honest answer of them. Your 3rd and 4th year are opportunities in medical school to really showcase your clinical skills. So if your team in that particular hospital is very impressed by the way that your knowledge is, the way that you approach patients, the way that you work as a teammate, sometimes they'll kind of overlook those tests and overlook some of those GPAs and look at you as an individual. Like, is this person got potential? Because reality, you don't really become a full-fledged doctor until you go through the training of residency. You may have the knowledge, you may have the experience, but even by law, you have to complete at least the 1st year of intern year to even touch a patient. Otherwise, you cannot be licensed in any of the states in the nation, including Puerto Rico. So this is the portion where you're molded. You're really made into the physician that you are in. That's where you kind of come out of your residency program, and then you apply for licensure and, become board certified, and then practice, in the area you choose to practice in. Depending on your training program. So it's a tedious process. It's an ever-changing process. Since I went through the process in 2010, it has changed multiple times. They actually got rid of the clinical skills portion, which was an actual portion of the step where you actually had to perform an actual exam. You would get different clinical cases across 10 to 12 patients, and they would grade you behind like a window you couldn't see them on, and you either pass or failed that. So that was part of the application process as well, but because of COVID, they got rid of that. And they feel like, what you do in your medical school and how they observe you will be suffice, and then basically what you're showing in your clinical rotation. So the other competing element is that there are now more medical students than there are spots for residency. So say the nation typically graduates 60,000 students, there may be only 40,000 residency spots. So 20,000 of those students are not getting residency spots, which is a little scary. Hopefully the government does open up a lot of these more residency spots, because most of the residency program is funded by Medicare and Medicaid. So it's ACGME, the Accreditation of Medical Education. They're a federally funded program. It really depends on a lot of the political aspect of things and the funding. Right now, because of COVID, there are a lot of physicians retiring. They're trying to fill that gap with advanced care providers, but unfortunately, advanced care providers require more experience and a skill set. There may still be a certain gap. And even then, there is a huge gap in primary care, because a lot of doctors who are older are retiring and they just don't want to practice anymore in this type of setting. So there's going to be a lot of adjustments, I say, within the next, 5 to 10 years. So your process may be completely different, but you have to kind of keep up with that process and just keep figuring out ways to, succeed through the program, and finding mentorship and, different people who are at different levels within that process that are closer will help you really be successful through their own experience.
I have a question about like schooling. So I've seen like different types of certifications within the medical field, like dental hygienist, stuff like that. Would you recommend like going for these certifications or going the full like 10, 12 yards, going to college, medical school, all that?
Yeah. So as my grandmother used to say, all five fingers of the hands aren't the same, right? So you always want to kind of look at what is your, and that I originally posed the question of where do you see yourself in 10 years? Because when I was in high school, when I see like all the cool kids doing the cool stuff, and I wasn't like a cool kid, but I wasn't like a nerd at the same time. I was like, all right, what am I want to do in 10 years? Where do I see myself in 10 years? It really depends on what your situation currently is. You know, if you have the ability to get some of the sponsorship financially from, you know, a source to kind of get you through the loans that are required for both college and medical school, then yes, you should just continue to pursue it and try not to take too many breaks, because you're going to have to explain why you had certain breaks. But if you don't foresee that and you just kind of want to take it in a stepwise fashion, then yes, you can definitely pursue something like, it depends on the area you want to do. If you want to be a dentist, then yes, definitely doing a dental hygienist for 2-3 years to kind of get the experience, see what it's like, and then eventually move into while you're taking courses, that's fine. The one thing that I felt that I wish somebody would have told me before going into college was that it's not a race. You don't have to finish in 4 years. And colleges or business versities are just that. You know, unfortunately, no one tells you, oh, you can only take Chem 1 in fall. You cannot take Chem 1 in spring. I think this is why sometimes over even the bigger universities, some of the online programs are going to be more successful because it's more of, this is when I can do it, and this is the time frame I can do it, and it's kind of very Amazon-y, right? Let me just go work on this course right now. I have 3 months. I'm going to knock this course out. You know, the universities, they have their vacations, they have all these things. It's like an adult camp after a while. So in reality, there's an experience, there's an enrichment to it, but the focus is, you know, you need to complete your prerequisites and you need to move on to the next step. Depending on what that time frame was, I was basically forced 1 year after college, 1 year after med school, and 1 year kind of right before residency as I finished the med school. So you're talking about 3 years. I, you know, still required in between just to kind of make up ground to kind of make it into the next phase. And I don't regret it, but at the same time, you know, did I really need to take 5 science classes? Could I have taken a summer course? Could I have taken something else? Sure, maybe. You know, should I have taken out more loans? Maybe. You know, it really depends, but at that particular moment, as I was going through everything, you know, I put pressure on myself. The other thing that I mentioned to Will and Natalia when we initially talked was the one thing I learned through this whole process, and I didn't really learn it until I actually passed my board exam, my step 1, many years after the residency, was you got to study smart, don't study hard. You should work hard, but the idea of studying smart is, you know, first, it's going to be very hard for you not to compare yourself because it's such a competitive field. And college all the way from pre-med status all the way into medical school. But the other thing is, and again, 5 fingers hands are the same. So if you keep thinking about that, I use that with my patients all the time, you're going to see yourself as an individual and you're just all equally important. But by studying smart, I mean, if you're a morning studier, but your friend who's acing the class is a night studier, there's no way you're going to be able to stay up at night with a bunch of Red Bulls and think you're going to do just as well as your friend because that's their method. You know, so use the time frame that you have. Make sure that the time you do use to study, you know, you're not falling asleep or that you're not needing to work out or do something to kind of relieve stress. But, you know, it's focused, it's what works for you. And, you know, and using that method that achieves the goal that you want, you know, achieves that particular grade that you need, is going to be the method that works for you. So that's what I mean by studying smart. A lot of us, again, are not our parents aren't PhDs, our parents aren't physicians, a lot of us, our parents are, working class citizens. My mom, has an associate degree. My father had, he had gotten his master's when I finally got my master's later on in life, but, it was different types of schooling at that point. And schooling has even evolved. When I did my master's program, I thought I was done after med school. I was like, that's it. I'm never going to study again. The only test I have to take is 10 years from now when I have to recertify, and that's it. Then 2 years later, after I set up that clinic, they offered me a master's program. They're like, this is a new master's program we're setting up. You're going to be a second pilot. If you want, you go for free. It's $120,000 degree that you're going to get for free. You only have to work with the health system 2 years. I was like, And I told my wife, and she was like, yeah, hello. I was like, okay, I'll do it. 75% of my program was online. So because I work 1 week on, 1 week off, I work 7 days in a row. And then I'm off for 7 days in a row. I was like, all right, I think I could do this. And sure enough, 2 years later, I was able to graduate with a master's degree, and then it was funny because I'm sitting in the graduation and I'm looking at all these PhDs that are going by. I'm like, maybe I could do PhD too. And my wife's like, don't you even think about it, so, but the world's, there's the sky's the limit. So many of my leaders have multiple degrees behind their name, and I don't think it's so much the credentials, it's your growth. It's your own personal growth. It's opening the doors to something on another level. And you have to be open to that. One of my favorite movies is Forrest Gump, because you see in the beginning of the movie, the guy's crippled. He's considered an idiot or stupid, and he's simple. Like, he just basically does what he's told. He goes through certain things in life and he becomes successful, and without really knowing it or, wanting it. But at the same time, it's a beautiful movie because, again, like he says, life is like a box of chocolates. You don't know what you're going to get next, right? But if you're really open to it, you can do some amazing things. And everyone has a unique profile to them that they can contribute in many, many ways. So it's a long-winded answer to your question, but yes, you definitely take those different types of paths, because there's a lot of different opportunities that open up. Lin-Manuel just gave an interview talking about how he originally wanted to do film and for In the Heights and in college, but he couldn't afford it. He actually wanted to minor in filmmaking, and he didn't. So he ended up doing whatever degree he did. Then he started writing the plays, and then all of a sudden it evolved into what he originally wanted. And he's like, and I didn't know anything about film. And I don't know if you've seen In the Heights. I highly recommend it, but the film is phenomenal. It is something I've never seen in my life before. And that his originality is kind of what made him unique from a film standpoint. So again, we have so much to bring to the table that, the sky's the limit.
Thank you.
My pleasure.
Nick, I have a question for you.
Sure.
You mentioned you had test taking anxiety. Can you talk a little bit about that and how you overcame that?
Yeah. So it's interesting. When I used to take a test, the way I described it to my friends was, when someone asks you what color the sky is, you say blue. That's the answer. You don't think about anything else. For me, I would be like, because I'm like a daydreamer. So I'm like, maybe it's nighttime. Maybe it's, maybe there's a storm coming. Maybe, it's 8 o'clock in the evening. They really didn't specify. I'm going to put gray because I don't know. I mean, maybe, so you would overthink it. Or I put blue originally and then I switched it to something else. I made the mistakes of, using every book out there thinking I was going to get more knowledge by that. And again, that's where I go back to my study smart, keep it simple, or like they keep it the KISS method, keep it stupid simple. I'm a very visual person. So I wasn't in the era where you guys have YouTube now, you have the Wikipedia, you can look stuff up, you can read, you can listen to something. Back then there wasn't that. It was mostly textbooks written by the professor or, from a national company. And there were multiple handbooks and all these things. And half the time, half the lecture would come to the lecture and half of them would come from from class. And I think, what it is that you need to keep a certain level of humility when you're taking these tests. You can't really take you have to put your pride aside, and you have to really just focus on, okay, what did I get wrong? Yesterday, for example, you have to recertify for advanced life support. And I always get nervous with these tests. And I actually did a lot better than I thought. Out of the 60 questions, I only got 4 wrong. And I'm like, oh my gosh, that's great. I could just walk away and be like, peace, I don't have to learn about anything else anymore. But I went back, again, what did I get wrong? Tell me why I got it wrong. Can you explain it to me? And I'm a physician that I do this every day, but we don't know everything. And again, COVID is another thing that I go back to, because we're still learning, and this is a very humbling disease, where constantly we're getting newer and newer knowledge. And that's the beauty of medicine. During my my medical school graduation, our padrino, which was the neurosurgeon for our class in Mexico, he says, there's one thing I could tell you is this: whatever was correct today could be wrong tomorrow, and whatever was wrong yesterday could be correct today. So never stop reading, never stop learning. And I think, what I eventually kind of found was I'm always very organized, but I'm too disciplined. So if I had a 200-page chapter, I'm like, all right, I'm going to get this chapter done, today. I don't care if I only retain 5 words from it. And that's not the way to go, right? It's the whole learn it, try to teach it, and then apply it session, or do practice questions. When you're taking these exams, make sure you're hitting where you want from a practice standpoint. Otherwise, don't sit for it, because every time you take these exams, it's like a tattoo on you. It follows you. It marks you. So, I went into my first exam thinking, I got this. This is mind over, everything else. I'm going to kill this exam. And I went in there thinking I did awesome, and I did horrible. By the 4th time I had finally taken the exam, I thought I completely failed. And I was like, oh my God, this is horrible. And I had a lot of pressure under me, because if I didn't pass this last time, I had to go back to Mexico and do a whole year in some remote town, just so I can get my medical degree, get my actual, what they call the título, because I basically had run out of my chances. So it was a lot of pressure, but that pressure is good sometimes, because in medicine, you do work under pressure. If a patient's not feeling well, you have to figure out what's going on and how to address it and everything else. You can always tell this time of year, in July, they tell you never get sick going in the hospital, because this is where all the fresh medical students come out of med school, and they start, being a doctor. And you can always tell who the newer ones are, because they're all running to the room where there's an actual emergency. But you can tell who one of the most, because they're actually walking, and they're walking at a very considerate pace, and it's because they're thinking, they're observing, they're really kind of getting ready for whatever they're going to encounter. And that's the kind of type of energy you want when you kind of go into these things. So in reality, I think it's just you got to exercise. That's really important for the mind. Really, my forms of exercise, I love to play soccer, I love to play basketball. So at least do it 2 or 3 times a week, especially when you're studying, because that is just going to help you with a lot of the neurons, a lot of the aerobic cells, and it's going to allow you to kind of be at a more relaxed state. Every so often, you need to take a break. It can't just be study. You got to go see a movie, go do something, unplug for a minute, and then get back into it. And then if you're struggling, what you need to do is just seek help, find out where there's somebody that can kind of break it down for you. And you'll always, there really never is a bad student. It's always, teachers who are not as good at teaching or have a different method that people learn from. So you have to find someone that you really vibe with that can break it down for you, whether it be a classmate, and that will just reinforce that other classmate's knowledge. So you're doing them a justice by helping them reinforce, and they're doing you a justice by teaching you. And then same thing, you reinforce what you know by paying it back. All right, I'm going to break this down for you, and it's amazing how much you can get out of it. But time management is very important too. So there are many factors for anxiety that can interplay within a certain situation, and that can create certain elements of panic. If it gets to the point where you feel like you don't know longer how to control it, that's when you should go and seek professional help, because there may be genetically a history of this. You know, you may have an anxious family member and this is encrypted in your genes, and there's a reason behind it, and you need to get help. There's medications out there for it, there's therapies for it, and there's coping mechanisms, because not only is it going to affect you during your study period, it's also going to affect you when you're in training, when you're a professional. It's not something that's going to go away because it's a part of you. So by helping yourself in engaging or understanding ways on how to treat it is really important. And a lot of, you know, unfortunately, the stigma of mental health is something that isn't as widely addressed, or it should be a little bit more understood. You know, there are physical and you know, physiological components to a lot of imbalances. It's not just because that person's local, you know, and they just can't get it together. No, there's a lot of other elements to it, and not only medication, but through techniques, you know, on how to cope is really important to learn that, because then you can apply that and use it with your own family members that may be suffering from the same thing as well.
Tons of great information there. Really appreciate you sharing that last piece, especially. It seems like a lot of what you're sharing comes down to that self-awareness piece, and really knowing yourself and knowing what you're good at, knowing when you're struggling, knowing when you need help, and being able to recognize that. So I think that's a really important message.
Yeah. And you have to step out of your comfort zone. I mean, I have to leave the country, you know, to accomplish my dream. I went to Mexico, which you know, everyone, at least as an American, think, okay, Mexico is a dirty town with, like, you know, the Mexicans with big hats and the guns and the stuff you see in the movies, and it's nothing like that. It's a beautiful country. And it was the second biggest city in Mexico. So that was an awakening for me, you know, thinking all these people want to come into the US. No, this is not the case. You know, they are happy where they are. They enjoy their lives. You know, so understanding that, stepping out of your comfort zone. I wanted to be in New York. That was my main goal. I want to come back home. I want to come back home. That's all I want to do. The first opportunity I had to come back home, and I had an opportunity to be home during residency. It actually was a toss-up between Kingston, New York, which is only about 2 hours away from here, which was the original capital of New York, fun fact, versus Leominster, Massachusetts, home of Johnny Appleseed, about 3.5 hours north of New York in Massachusetts. And I'm like, all right, so which, and I had to decide between the two. I could have easily stayed in New York, but I knew that this particular portion of my career was going to be the most important, because these were the people that were going to train me. And this training was what I was going to carry with me for the rest of my life. Little did I know, I did not know this until I was actually almost done with my second year. That program was a top 10 in the country. And I didn't know that. And I'm like, what am I doing here? Like, I don't belong here. But it just fate and, you know, prayers help. I mean, I prayed a lot, you know, when I was at my most downest. I remember walking New York, you know, New York City is, they say, the concrete of dreams. You look up, you can have $1 walking down Fifth Avenue, you feel like you're a millionaire. You know, just you have that motion, you have that ability to say, I'm going to do this. And, you know, it doesn't matter who tells me I can't, I'm going to do it. And when I come home to study for my big tests, I would go into the city and do it, you know, and I'm and that was kind of my relief. That was my happy place. That was the ability for me to get to where I am today, because there was something that just kind of kept me going and didn't deter me from, you know, all of that. Even in residency, I had problems, you know, and the support you have, the friends that you have, there's going to be certain friends in certain situations at certain times in your life that are going to be very meaningful for you. And you may not carry those friends forward as an adult, but in that particular instant, those particular people are the ones that are going to hype you up. You know, they're going to get you where you go. And eventually, once you settle to where you're most happiest, I could make double of what I'm making right now if I go to Texas, but I'm not happy in Texas. The Chinese food is horrible in Texas. So like being in New York, it makes me happy. And you try to find that, and you put a price on time, you put a price on family, you put a price on happiness, and it equivalates to making that much more. If you're going to go into medicine, I'm going to tell you straight off the bat, for money, then don't even try, because yes, it's a delayed gratification, but I can tell you from multiple studies, a school teacher actually makes more money than a physician. And the reason behind that is school teachers have summers off. They have, vacations in between. I'm not saying it's an easier job, but per hour, they're actually making more than a physician. Physicians, like when I'm on my work week, I'm working minimum 84 hours. Today, I'll probably end up working, at least 16 hours, but, because I've been going since this morning, 5 a.m. But, you're trained to do that. It's not something that, it's you just do it overnight and it's done. Your time becomes a certain value, and your debt becomes a certain value, because when you graduate medical school, I'll be transparent with you guys, every dollar you borrow, you owe back 3. So, there are certain people that are going to be affluent that they're going to have that taken care of and maybe not realize the struggle. But there are a lot of us who won't, and who are going to carry what I call a mortgage without a house without a mortgage without a home. You're basically going to be owing anywhere from $2,000 to $4,000 a month, taken out of your paycheck, because that is what your loan debt looks like. And there are loan repayment programs, and there are other things that are out there, but it still is going to come at a cost to you. So that it always kind of equivalates. Plus, you're starting families later. There's going to be so many things in life. Your friends are going to have kids already that are going to be graduating. I have friends who are graduating high school already, and my daughter's only 2 years old. So, there's going to be a lot of sacrifices you're going to have to do or change. There's going to be irregular in your life. But, again, the end of it, it's going into medicine, you're sacrificing a part of you to help, others that go beyond your workflow. You get training, but depending on the type of love and delivery of care you give behind that training is kind of what makes you a good doctor. And that was always my goal, is what makes you a good doctor. And it was compassion, it's empathy, it's humbleness, it's, kind of going that extra mile to be there for a family member or a patient who is at the end of life, or being there for a particular moment for someone, a couple who's having their first baby, so there's a lot of elements that belong to it. But all in all, it's definitely what you put into it is kind of what you're going to get out to it.
Amazing. So much value, Nick. You've definitely shared a lot of personal information, which I appreciate. And I think that last piece, the financial piece about medical school is really important for students to just be aware of that knowledge and allowing them to make more informed decisions. I wanted to take this time because I know you had a mini activity. I want to be mindful of our time, but do you want to run our students through that activity?
Sure. So basically what I've talked about is, the different elements of how to achieve success, and one of the things I was going to teach the students today was basically how to write a prescription. So when you write a prescription, basically you write the name of the drug and the type of drug it is. So in this particular case, I made up a drug called Determination Patch, and it's 100 milligrams. So SIG means the particular directions on how to take the drug. So when you actually write the directions, you say, say, take one, whatever in this particular case, it's a patch, and patches usually are applied transdermally over the skin. And then the frequency, right? Is it once a day? Is it twice a day? Depending on what the drug instructions are. And then for how long? For 1 week, so this one, I said determination. This is the prescription for success. One of the many, right? So you have multiple drugs for particular illnesses. So this is one of them that I've made hypothetically. So determination, your 100 milligram patch, you can put one patch transdermally twice a day for 10 years, right? And then you can refill it for another 2 times for another 20 years. And then use just the dispense DISP, that's how many patches they're going to need, right? So in this particular case, it should actually be double of 3650, so 7,300 patches, right? But again, it's just giving you guys a concept of how to go about writing a prescription. Most of it's done electronically now, not most of it now self-populates, so it's nothing that you have to actually commit to memory, but it gives you an idea of what the flow is when a particular provider is writing out a prescription. So what I would want you to do is write down an element of success that you think you would need in order to achieve the success. So I'm just going to pick on Natalia just because she's going to be an easy target.
I definitely like your patch a lot. I think determination is totally key, especially experiencing it through you, through my sister, like through so many people now becoming a physician. Like it's intense. I dabbled in pre-med, so I would say resiliency. I think you spoke a lot to that in general, but I do find that in life, and to your icebreaker question as well, like failure is really just an opportunity in disguise. And at the time, there can be so many negative emotions attached to it. But I think as you get older, and maybe something I wish I would have learned how to do faster is shaking it off quickly. It's seeing like, okay, I'm not going to treat myself like I'm being problematic. I'm going to treat the problem that I'm facing. And once you see life through that lens, let me tell you, it's like, it's all of a sudden you're not on the ground, you're on a trampoline. Every time you fall, you just bounce right back up. So I would say resiliency is the key to success, at least for me.
That's great. Thank you. Any of the students want to take a jab at it?
I would love a patch for focus. That's for sure. I'm sure they actually have real prescriptions for that, but yeah, I would need something for that for sure.
Definitely. Yeah, and I think with focus comes discipline, right? So you have to be very disciplined to kind of do what your mindset is for when you're going through. So, and I definitely want to kind of add to what Natalia said was, that self-motivation. You're going to be your worst or best, and enemy or friend. So I find myself, like I said, I daydream sometimes, and I'll talk to myself like, come on, let's do this. Let's get up. Let's figure it out. Okay, this didn't work. Let me try something else. And you constantly kind of just keep reworking and rescheduling and remotivating yourself to kind of reset and go through it. But when you look back at it, yeah, you definitely can appreciate the scars and the bruises and everything else. It makes your skin tougher because, in the profession, it's not easy when you have somebody disagreeing with you, or, today I have somebody that's got end-stage cancer, and, the family really wants to pursue whatever they can pursue. You have to accept that, and okay, let's just keep going, even though unfortunately the patient, may not thrive from that, but you have to kind of apply that respect. So a lot of people go into this notion that medicine is all about saving lives, and there is a good portion where you do, but there are other portions where death is a part of life. It's a natural process, just like childbirthing, and it's a difficult process. It's not an easy process, but it's going to happen regardless whether you're there or you're not. So you just try as a provider to give them the best and most comfortable experience possible, and if you kind of maintain that mentality, you won't go wrong.
That's beautiful. So we have our final portion of the show. This is our final 5. So Natalia is going to ask 5 questions, and then we're going to send everyone on their way. So If you don't mind, Natalia, take it away.
Yeah, sure. So to start our final five, Dr. Nick, we'd like to know if you could speak to your high school self today, what is one piece of advice you would give yourself?
To my high school self, I would say, take it easy. It's not a race, but and study smart. Get rest, exercise, eat well, and don't try not to compare yourself to others too much.
I like that. I like that it was a whole like recipe. It's not just like a little, this is the regiment. This is the piece.
Exactly.
Our second question for you is we want to know what is your favorite wellness or medical related book?
My favorite wellness or medical related book has got to be there is a book by Atul Gawande. He's a endocrinologist, I think pediatric surgeon out of Harvard. It's called Being Mortal. We work with a very elder population where I am here in Long Island. So it talks about the process of aging in America and how he compares it to India and his grandfather's care, how our society really isn't set up to care for our elderly, and how it's a really big problem. And there's something that's very new now, but it's going to be more and more prominent: caregiver burnout. So people who are caring for the elders, like a mom or dad, who have Alzheimer's. We have a patient who's 64 who's got Alzheimer's already. It's very sad. They're very young. 64 is a new 54. People are living longer. How that it's a change in their life. They have to constantly watch out for them, take care of them. We don't think we're going to get old, but we are. So, these are valid concerns for our aging population. And he talks about how different facilities had came out, how there's a fear of losing independence from the elderly. So it's one of those books that when you pick up, you just can't put down because it just is very intriguing. And it's a great, great book. So I would highly recommend it.
Yeah, thanks, Nick. That sounds fascinating. Number three for us is what is a common trait that you notice people in your field, in the medical field, like have that makes them successful?
I think humility is very, very important. Most of our top leaders, Michael Dowling, who's our CEO for Northwell, he actually was an immigrant from Ireland who had probably never thought he was going to be a CEO of a big health system. He came very poor from Ireland, working in the fishing docks down in the South Street Seaport, and slowly was able to kind of develop himself and get to where he was. But being an immigrant with a very thick accent, it wasn't easy for him. So he is very down to earth. Like when he goes to events, he's constantly taking pictures with people, saying hi. And I think that having that humility and really never forgetting where you come from and that compassion is kind of what's going to lead you to a better tomorrow. And great leaders of this world like Gandhi, Mother Teresa were just like that. They would just get in there. They wouldn't fear it. They just really knew that they were no better than anybody else. They always would put themselves at other people's disposition. So I think that's really important.
I love that. Okay, so what are some of your hobbies?
So music is my passion. I've listened to the In the Heights soundtrack, and I'm not endorsed by the In the Heights in any way or form, but it is a phenomenal movie. So I've listened to the soundtrack about 1 billion times because it has all the elements I love. It's jazz, it's hip hop, it's salsa, it's merengue, it's bachata, it's you name it, danzón. Being part of a musical group, and playing the cuatro and being a trumpet player since the 3rd grade, music has always been my outlet. I even took my cuatro to Mexico. And at times where I was most stressed, I would go ahead and just play a dance, or I would play something just to kind of relax me and take a break for a quick minute. So yeah, music is my passion.
And for our the final five, we want to know what gets you hyped.
What gets me hyped? I think just seeing people progress and helping those who otherwise may have settled or been complacent in the past. So, for example, one of the girls, like I was mentioning before, who was an ED clerk, she really was interested in going to medical school or going to business and associate program. She's actually in the program right now. We have a nursing assistant who became a mom at a very early age, and didn't think she had it in her to become a nurse. And she is slowly proving herself wrong. And I think it's with the support of all the staff. We constantly tell her, listen, you can do this, and it's more valid to her because she's raising a human being. I mean, the kid's almost a teenager now, but she's working a full-time job. She's going to school and she's setting a great example for her child. So I think, that is very noble. There are some people who really don't have anything to do. They have no responsibilities. They pretty much are handed an education and they don't really want to do. So I think that's kind of what hypes me up. And then last but not least, I think, again, experiencing, if you guys haven't seen the Hype in the Heights, watch it. The fact that we can represent who we are in any place in the world, and just be ourselves and not being afraid of that. Embracing our differences, I think is really important. I enjoy today. Our chief of medicine was having a really hard time speaking to a daughter of a patient who had a stroke. And, I had admitted this patient 2 weeks ago and he was still here and he was just trying to explain to this people. And he's like, can I please, he's like, I just feel like I need you to kind of be with me to explain this stroke, so they can really understand it. Because I'm not getting through with the interpreters. I'm not getting through with the staff who's, here with that speaks, limited Spanish. And I, thankfully through my own physician self, I was able to break it down for them, and they appreciated that and he appreciated that. So I think, embracing what we are and what we can bring to the table is going to be really, really important. So, yeah, and know that again, I wouldn't even say the sky's the limit. I'd say the universe has no limits. You really just need to go out there, put yourself out there, and even stuff like this, what you guys are doing is phenomenal, because there's always going to be that one person's going to be that one thing you said they're going to carry with them for the rest of their life. So, I applaud you guys too, because this is amazing and we need more of this.
Thanks, Nick. Yeah. I really appreciate you. I love that that's your hype. I think that's kind of the business we're all in, so to speak, right? In some way or fashion or facet, like just really knowing, like, I'm here to help, bottom line, in whatever way and whatever talented way that I'm able to. So I love that. Thanks, Nick.
Yeah, my pleasure.
Yeah, Nick, we just wanted to thank you. I want to thank you again. We really appreciate you. You're in the hospital right now on your work night, and we really are grateful for you taking the opportunity to speak with us today.
Thanks for tuning in to this episode of the Hype Light Podcast Experience. If you like this episode, be sure to rate, review, and subscribe so you don't miss out on the latest episodes.